The remaining classifications and score in the surgery. First one is Maastricht classification of donation after circulatory death. It is divided into 5 categories, and basically we have to see the circumstances which are controlled and which are uncontrolled. Type 1 is dead on arrival, that is irreversible cardiac arrest on the street. This is not in our hands, so it is uncontrolled. Then unsuccessful resuscitation involves patients brought into the emergency room while being resuscitated by the ambulance crew. This is also uncontrollable by the hospital staff. Then type 3 is imminent cardiac arrest in the intensive care unit. Means cardiac arrest अभी होने वाला है तो उसको हम कंट्रोल कर सकते हैं. फिर कार्डिक अरेस्ट. टाइप 4 इज कार्डिक अरेस्ट ड्यूरिंग और आफ्टर द ब्रेन डेथ डायग्नोस्टिक प्रोसीजर. इट कैन ऑल्सो बी कंट्रोल्ड. Then type 4 is unexpected cardiac arrest in intensive care. Unexpected cardiac arrest in intensive care, that is also not our control, so it is also uncontrolled. Basically we have to remember type 1, type 2 and type 5. 1, 2, 5 are uncontrolled and 3 and 4 are controlled. Then next comes the Masoka staging for the thymoma. Masoka staging is divided into 4 stages. Stage 1 is completely encapsulated. Stage 1 is completely encapsulated. Then stage 2A is microscopic invasion through the capsule into the surrounding fatty tissue. Microscopic invasion. Then stage 2B is macroscopic invasion. Then stage 3 is macroscopic invasion into the adjacent organs. Then is stage 4A and 4B. 4A is pericardial or pleural implants, and 4B is lymphogenous or hematogenous metastasis to distant sites, to the extrathoracic site. Basically it is for thymoma. एंड स्टेज 1 ने कम्प्लीटली एनकैप्सुलेटेड है. ठीक है. स्टेज 2A में क्या है, माइक्रोस्कोपिक इन्वेजन होगी थ्रू द कैप्सूल. स्टेज 2B में क्या है, मैक्रोस्कोपिक इन्वेजन होगी. फिर 3 में क्या है, एडजेसेंट ऑर्गन्स में चला गया. 4A में है पेरिकार्डियल और प्लूरल इम्प्लांट्स, एंड 4B में है लिम्फोजिनस और मेटोजिनस मेट्स टू डिस्टेंट साइट्स. Then next we have the SIRS, Systemic Inflammatory Response Syndrome criteria. It includes the following 4 parameters: temperature either less than 36 or more than 38, respiratory rate more than 22 per minute, heart rate more than 90 beats per minute, and WBC less than 4000 or more than 12,000. Any two of these 4 confirms the diagnosis of systemic inflammatory response score. Okay, temperature, respiratory rate, then heart rate, and then WBCs. Then is Q-SOFA score. Q-SOFA is quick sequential organ failure assessment. It includes 3 parameters. Quick है score तो इसमें सिर्फ 3 ही parameters और इसमें भी 2 से ज़्यादा चाहिए, 2 or more. Systolic blood pressure less than 100 mm of Hg. Then is respiratory rate more than 20, and Glasgow Coma Scale less than 14. Systolic blood pressure less than 100 mm of Hg. Respiratory rate more than 20. In SIRS it was 22. In here it is 20 per minute. And Glasgow Coma Scale less than 14. Basically it deals, Q-SOFA is about the CVS, about the respi, and about the CNS. And in SIRS inflammation related, so temperature, fever, and WBC count, and CVS and respi are there. Okay. Then comes the shock index. Shock index is heart rate by systolic BP. Heart rate by systolic BP. As for shock index, as for systolic BP. And if it normally it is less than 0.7, and if it is more than 0.8, it considered to be elevated, and consider the occult shock, possible need for the transfusion, and post intubation hypotension. And if it is more than the 1, then it is predictive of excessive lactate, elevated lactate, and 28-day mortality. Then there is modified shock index. Modified shock index M, then heart rate divided by mean arterial pressure. Modified shock index में M आ रहा है, तो heart rate divided by mean arterial pressure, MAP. Then this is the stages of the Damage control surgery. It is basically divided into 4 stages. First is stage 1 is primary emergency surgery. Here we have to only remember the headings. No need to go in the details of this diagram. Stage 1 is primary emergency surgery. Then stage 2 is in the ICU. And we have to correct the triad of the hypothermia, acidosis and coagulopathy. Then stage 3 is definitive surgery. And stage 4 is abdominal closure. So we have to remember the 4 stages. Stage 1 is stage patient selection is also known as stage 0. Then stage 1 is primary emergency surgery. Stage 2 is intensive care unit. Stage 3 is definitive surgery. And stage 4 is abdominal closure. Then is Southampton wound grading system. Southampton wound grading system. It is divided into 5 grades. Southampton S. S is looking like 5, so it is divided into 5 grades. Grade 0 is normal healing. Grade 1 is normal healing with mild bruising or erythema. Grade 2 is erythema plus other signs. Grade 3 is clear or homoserous discharge. Grade 4 is pus. And grade 5 is deep or severe wound infection with or without tissue breakdown and hematoma requiring aspiration. Grade 1. Grade 1 is normal healing with mild bruising or erythema. Bruising or erythema, then it is further divided into 1A, B and C. 1A is some bruising, 1B is considerable bruising and 1C is mild erythema. Some bruising, considerable bruising, mild erythema. Then stage 2 is erythema plus other signs. Stage 2 is further divided into 3 parts: 2A at one point only, 2B at around sutures, 2C along the wound at one point around the sutures and along the wound. Then stage 3. Stage 3 is homoserous or clear discharge. It is 3A is at one point only, 3B is along the wound and 3C is large volume. Here around sutures is not present. Okay, it can be remembered like this: serious discharge will be trickling down, so it will not remain around the sutures. At one point only, along the wound and large volume. Then stage 4. 4A at one point only and along the wound. Both the discharges, while homoserous or pus, it will be at one point and along the wound. Around the sutures वाला पॉइंट सिर्फ एरिदीमा में है. ठीक है. फिर उसके बाद आ गया ए सेप्सिस स्कोर. ए सेप्सिस स्कोर का निमोनिक ही ए सेप्सिस है. ए फॉर एडिशनल ट्रीटमेंट रिक्वायर्ड लाइक एंटीबायोटिक्स, ड्रेनेज ऑफ पस and debridement of the wound. Then S is serous discharge. Then E is erythema. P is purulent exudates. S is separation of deep tissues. I is isolation of the bacteria. And S is stay in the hospital prolonged over 14 days. इसमें 3 चीज़ें जैसे सीरियस डिस्चार्ज हो गया, एरिदीमा हो गया, पुरुलेंट एक्सुडेट हो गया और सेपरेशन ऑफ द डीप टिश्यूज, ये तो सेम है एज द साउथहैम्पटन स्कोर. Different क्या? Isolation of the bacteria, stay in the hospital prolonged over the 14 days and additional treatment. So let's revise again. A for additional treatment, S for serious discharge, E for erythema, P for purulent discharge, I for isolation of the bacteria and S for stay in the hospital prolonged over 14 days. Then next comes the scores for the acute pancreatitis. First is Glasgow score. Glasgow score can be remembered by the mnemonic itself, pancreas. We don't have to remember the exact values, just the parameters. Okay. P for the partial pressure of oxygen, A for age, N for neutrophilia, C for calcium, R for renal function, E for enzymes, A for albumin and S for sugars. Okay, let's revise again. P for partial pressure of oxygen, A for age, N for neutrophilia, C for calcium, R for renal function, E for enzymes and A for albumin and S for sugar. Enzymes are basically LDH and AST. LDH and AST. Glasgow criteria. Okay, next we have the CT severity index. CT severity index is Balthazar score plus pancreatic necrosis. CT severity index is sum of two scores, Balthazar plus pancreatic necrosis. Balthazar score mnemonic is A, B, C, D, E, and pancreatic necrosis. We will see. Um, Grading of the Balthazar score. A is normal pancreas, B is enlargement of the pancreas, then C is inflammatory changes in the pancreas and the peripancreatic fat, D is ill-defined single fluid collection, E is two or more poorly defined fluid collections. ओके ए इज़ नॉर्मल पैंक्रियास, बी इज़ एनलार्जमेंट होगी, सी में इन्फ्लामेशन होगी, देन डी में सिंगल फ्लूइड कलेक्शन है और ई में टू और मोर फ्लूइड कलेक्शन. नॉर्मल है, फिर इनलार्ज हुआ, फिर इन्फ्लामेशन हुई, फिर पॉकेट बनी, फिर एक से ज़्यादा फ्लूइड कलेक्शन हुई. और पैंक्रियाटिक नेक्रोसिस कैसे डिवाइडेड है? नन accounts for 0, then less than or equal to 30% accounts for 2, 30 to 54, then more than 56, 0 2 4 6, and Balthazar was 0 1 2 3 4 and it is 0 2 4 6, less than 30, 30 to 50 and more than 50. Then we have the bedside index for severity in acute pancreatitis. Bedside index for severity in acute pancreatitis, biceps score. It is also same mnemonic, BISAF, bicep, blood urea nitrogen, impaired mental status, SIRS, systemic inflammatory response score, age, and pleural effusion. Let's revise again. Blood urea nitrogen, impaired mental status, then systemic inflammatory response score, then is A for age and P for pleural effusion. If one A, then age. If two A's are there in this score, then age and albumin. Okay. BUN pleural effusion, renal function आ गया और lungs का फंक्शन आ गया और CVS का आ गया, एज आ गई, SIRS आ गया, बाइसेप स्कोर. देन इज अपाचे 2 एंड रेंसन स्कोर. Two scores are remaining in the pancreatitis. Apache 2. Apache 2 is mnemonic is Bhagwat Nakchor. BHAGWAT and CHOR. Firstly, B for blood pressure, H for heart rate, A for arterial pH, then G for GCS, W for WBC, A for age, and T for temperature. Here albumin is not there in Apache, and it is arterial pH. AP in Apache stands for arterial pH, and one A is for age. Okay, B for BP, H for heart rate, A for arterial pH, then G for GCS, WBC, then age, and then temperature. Bhagwat, then is नाक. नाक किसके लिए? सोडियम एंड पोटाशियम. देन इज चोर. चोर में क्या क्या है? क्रिएटिनिन. सी फॉर क्रिएटिनिन, एच फॉर हिमेटोक्रिट, ओ फॉर ऑक्सीजनेशन एंड आर फॉर रेस्पिरेटरी रेट. क्रिएटिनिन, हिमेटोक्रिट, ऑक्सीजनेशन एंड रेस्पिरेटरी रेट. आर्टीरियल पीएच अलग है और ऑक्सीजनेशन. क्रिएटिनिन, hematocrit, oxygenation, respiratory rate. Let's remember again. B for blood pressure, H for heart rate, A for arterial pH, G for GCS, W for WBC, A for age, and T for temperature.